Good evening. I'm Marangeli Lopez. Thanks so much for joining us for the CBS 19 News at 5. We begin with this. COVID-19 cases are an all-time high once again in East Texas, and this is data from Net Health that you're looking at there on your screen about the 7 counties it covers. You can see that we're nearly at 500 new cases of COVID-19 per day. And East Texas hospitals are seeing more and more patients needing treatment for COVID-19. Our Ashley French shows us how it's affecting one of our bigger hospitals.
It's been officially 2 years since the first COVID-19 case was detected in the United States. The virus and a new variant continue to strain our healthcare system.
It continues to run rampant across the East Texas market. We're seeing testing positivity coming in at about 60% across our community.
It's another challenge for healthcare workers to provide adequate care while trying to prevent getting sick themselves.
Earlier this week, we had close to 400 people that were out sick with COVID. Close to 100 nurses involved in that. So definitely impacting our ability to provide care to the community.
UT Health East Texas is going further than the 6-day isolation period when doctors and nurses call out sick.
As far as the CDC guideline goes, we have taken a little different stance in that we ask people to stay out 7 days before returning to work, feeling like 5 days. Even though it's within the CDC guidelines, I'm feeling like that's a little aggressive. And still poses some risk for our staffs.
And then there's ICU beds. Tyler and Longview currently have 11 ICU beds on hand, according to the Texas Department of State Health Services. With that amount of beds, it poses a concern for patients.
Our ERs at times have been overrun with people seeking attention, medical attention for COVID as well, which then impacts our ability to take care of the strokes, the heart attacks, the traumas that we need to take care of.
Dr. Cummins says vaccination rates remain lower than the average, with East Texas counties north, south, and east just under 50%, a number Cummins hopes will eventually rise.
Till this community is able to do that, we're going to continue to see, I think, this wave go for a while and potentially the next ones.
Reporting in Tyler, I'm Ashley French for CBS 19.
At last count, there are now 10 open ICU beds in Deep East Texas. All the hospitals there combined had just 1 bed available on Wednesday.